Good evening, everyone. We'll just wait for one more second while we admit the other attendees. Good evening and good afternoon, everyone. My name is Kor Swee King, but please call me SK. I'm your moderator for today, the TA6767 Secure webinar series. This is the fourth in a series of webinars for the Secure Technical Assistance Package of the Asian Development Bank. Today, we'll be speaking about private sector engagement in COVID-19 vaccination programs throughout Southeast Asia. We're very happy to have a group of distinguished speakers with us in order to unpack and discuss how the private sector has contributed to the successes of the COVID-19 vaccination programs throughout Southeast Asia last year in 2021 and this year in 2022. And if we have some time throughout this webinar, we'll also be speaking a little bit about what COVID vaccination programs will support different vaccination programs and how the private sector can also get involved. It gives me great pleasure, really, to invite Dr. Eduardo Banzon. Dr. Eduardo Banzon is the Principal Health Specialist of the Human and Social Development Division in the Southeast Asia Department in the Asian Development Bank. Dr. Banzon will give us a brief overview about the Secure webinar series, as well as the Secure TA program. Dr. Banzon, the floor is yours, and over to you.
Thank you, SK. And first of all, again, as like was SK, we welcome everyone for joining the webinar. Secure is a long word, but essentially it is a technical assistance project of the Asian Development Bank of the Southeast Asia Regional Department of ADB, of the Social and Human Development Division, where we're helping developing member countries in Southeast Asia design, develop programs or COVID-19 vaccination, support them in implementation of this COVID-19 vaccination, make sure that the best practice and lessons are studied, are documented, are shared with other countries, including us. We have this afternoon sharing lessons on the role, the participation, the engagement of the private sector in COVID-19 vaccine, and then eventually also to get these lessons to address other future health security concerns and future pandemics. So we have been conducting these webinars. This will be the fourth one. There will be others. We have a webinar to look into the role of gender on COVID-19 vaccination. We've also haven't taken a look at how it impacts climate change. We'll be having more on vaccine communications, on logistics, on vaccine information systems in the coming months. And we look forward also for everyone to join us. So SK, back to you.
Thank you, Dr. Banzon. We're very happy to have Dr. Banzon here with us today to provide the leadership for the Secure webinar series and also the Secure Technical Assistance projects that the Asian Development Bank hopes to do with its member countries, especially those in Southeast Asia. Now, I would like to invite Ms. Ayako Inagaki, who is the Director of the Human and Social Development Division in the Southeast Asia Department of the Asian Development Bank. Ms. Inagaki, the floor is yours for you to deliver your welcome remarks. Over to you.
Yeah, thank you. Thank you very much. And I would like to welcome all of you to the fourth Secure webinar, where we will discuss private sector engagement in COVID-19 vaccination programs in Southeast Asia with a selection of healthcare leaders built from across the region. This webinar is the latest webinar in the Secure webinar series, and it's intended to provide insight into the post-COVID world for Asia and the world. So as the world gets used to living with COVID-19, we realized that the governments alone are not enough to provide health security during COVID and for future pandemics. In other words, health security is everyone's business, from government to the private sector, civil societies, and of course, the individuals. So the best way for us to achieve health security is through shared responsibility for health. So that shared responsibility explains why today's webinar is so important. In Asia, the private sector is a significant provider of healthcare services with a reservoir of human capital, financial capital, innovativeness, and healthcare resources. So during COVID, we have seen how the private sector has rose to this occasion. In Thailand, Malaysia, and Indonesia, private hospitals delivered COVID-19 vaccination and COVID care. In Singapore and the Philippines, private clinic also delivered COVID-19 vaccination and helped fight vaccine misinformation. The capacity of the private sector helped the public sector manage the surge of patients and vaccination loads, which helped speed up the vaccination uptake and the coverage rates. So in today's webinar on private sector engagement in COVID-19 vaccination programs, we will hear experts, scholars, and practitioners talk about the role of private sector healthcare in the last 2 years. Their thought, insight, and knowledge will help inform and strengthen the effectiveness, efficiency, and equity of COVID-19 vaccination programs today, and perhaps other vaccination programs tomorrow. So I hope that this webinar will serve as an effective platform to raise questions and strengthen the discourse in getting the private sector involved in all aspects of COVID-19 vaccine development and deployment, from the research and clinical testing stage to the crafting of vaccine communication, to planning for vaccine mobilization, up to the monitoring of post-vaccine side effect and adverse effect after immunization. So I welcome you again to this fourth secure webinar, and I wish you a pleasant discussion. Thank you.
Thank you, Ms. Inagaki, for your welcome remarks and for welcoming us into this secure webinar. We're very happy to have you. If I may turn the floor right now to Mr. Dawal Jam. Dawal is the Principal Public-Private Partnership Specialist, or the Principal PPP Specialist in the Office of Public-Private Partnerships in the Asian Development Bank. Dawal will share his thoughts and also his slides about the ADB approach to private sector engagement in health. Dawal, we're very happy to have you. The floor and the screen is yours.
Thanks, SK. First of all, thank you very much, everyone, to spare the time to attend this webinar. My name is Dawal Jam, and I'll be speaking about ADB's approach to private sector engagement in health. And I'll be covering broadly health and not just COVID-19. So let me begin with a statement that around the world, around 400 million people every year don't get proper access to healthcare, and millions more are pushed into poverty because of out-of-pocket expenditure. And just to reiterate the point of sharing responsibility, governments alone cannot meet the rising demand for healthcare. So it is a shared responsibility between public sector and private sector together, to fight and to meet the healthcare demands. Going ahead to ADB's approach, and on the left side you see the regional departments, which is
Dawal, so sorry to interrupt you, but could you share your screen, please?
I'm so sorry.
Don't be.
I didn't realize. Is it
wonderful? We see your screen and it's going to be in presentation mode now.
Right.
Wonderful.
Well,
thank
sorry
you.
about this. I'll just take
Don't
a
be.
step back. And this was the statement which I wanted to make, and the statement about shared responsibilities. And now going on to ADB's approach, on the left-hand side, you see talks about our regional departments, which is regional ADB officers working in the countries and working directly with governments. And we have our sovereign teams who work on giving loans, senior and subordinated debt, sometimes even equity to within the governments at an agency level, at an implementing agency level. And in this case, mostly in talking about health sector, it will be Ministry of Health or Family Welfare, sometimes an angle of water and sanitation also. And that's not only just loans which our regional departments provide. They also assist governments in sector reform, policy reform, technical assistance. These days a lot of discussion about how to have vaccinations for COVID, and making policies for that, having procurement and logistics facilities, and overall capacity building within the government. On the right-hand side, you see our private sector operations department, PSOD, which works with private sector. The goals are the same: to allay poverty and to improve health sector. And we call it a non-sovereign operations. And the main role of our PSOD department is to provide debt and equity investments into private health companies which are active in health sector. And of course, there should be a development angle there. And PSOD department also provides a few guarantee projects and syndicates investments into projects. And we can go into details, but syndication basically means getting in other investors along with ADB for projects. And sitting in the middle here is the Office of Public-Private Partnership, called OPPP. And the OPPP actually helps the governments and private sector to come together through public-private partnerships to deliver health services. Usually, when we talk about PPPs, we say it is delivering public health through private sector. And to support PPPs, what ADB does through the Office of Public-Private Partnership is it provides a lot of capacity building, policy support, helps in improving enabling environment, and also helps governments in PPP project delivery and monitoring. A key area of our work is to provide transaction advisory services, which is end-to-end advisory to government agencies in how to structure PPP projects and how to get into a balanced win-win contract for both private partner and the government for provision of health services. So going ahead, I will first talk about PSOD and PSOD's landscape for investments. It's on the, we have a few regular areas which currently are there in our areas of strategic focus, but in the last year or so, there have been new opportunities which have also come through, and I'll quickly run through this slide. In terms of sectors, we are open to basically everything. And so coming first about, say, services, hospitals, clinics, elderly care, specialized hospitals, ophthalmology, mental health, everything. Then specialized services in terms of diagnostics, dialysis, then it can be medical devices, supplies, consumables. But last year, again, because of COVID affecting the whole health scape a lot, there's a lot of focus on pharmaceutical manufacturing, which also includes vaccine manufacturing, and increased focus on supply chains. Then again, we can't escape the digital boom which comes in health sector. So there's a lot of digital business models which have come up, and we are looking at that carefully and finding opportunities to strengthen private sector there. In terms of clients, we work with companies in DMC countries, and we focus on clients which have a development angle in their services, that they are focused on providing services somehow to the bottom of the economic pyramid, and that is very important for us to be investing in a company. Company supporting, universal insurance also is high on our agenda, particularly because universal insurance also reaches the economic bottom of the pyramid. So that's our area of focus. And again, in the last year, there has been a lot of South-South expansion, which technically means investment from one developing country or DMC to another. And we've seen India moving a lot to Central and West Asia, Thailand in the Mekong and Mongolia. And also, there's a lot of focus of governments on PPPs. And so the PSOD department can invest in the PPP projects. Generally, our financial instruments are more on the debt side. About 50 to 70% of our portfolio is debt and 30 to 50 is equity. The new things which have come up are social bonds, blended finance. Blended finance usually comes up with high development projects or climate focused projects. So, that's how we can reduce the cost of finance for private sector. Our focus a lot on climate finance, that has been increasing over the years, and we are very strongly going to follow it. So in future also, we are looking at sustainability bonds as opportunities for us to invest in. In terms of country focus, traditionally it has been Vietnam, Indonesia, China, India, all of Southeast Asia. New countries which emerged during the last year were Bangladesh, Uzbekistan, Georgia. And if there are more countries which show activity, we would be absolutely happy to provide finance there. Going on to the overall, landscape again of helping PPPs, we support first for upstream activities, and that is creating enabling environment for PPPs, and that would be supporting governments in some selection of projects, identification of projects, creating PPP policies or frameworks. A very critical thing is to develop value for money analysis, and so we support government in doing that. And while doing this, we work with PPP units and implementing agencies directly. Then we work on midstream, which is the whole preparation of the project, taking it to market, and finding the private partner to sign the agreement. And usually PPPs are long-term agreements, so it takes a bit of time, a while, and a lot of rigor to enter into a long-term contract. But ultimately, the idea is to get into a contract where government and private partner, both, they meet their objectives. Then the downstream support is once a PPP project has been signed between the private partner and private sector and the government, then it would need finance. And financing generally comes through two ways. On the government side, financing comes through our sovereign financing, and for the private sector, it would come from if the private sector needs financing, then our PSOD department can help there and provide financing. And all through this, we while we are doing upstream, midstream, downstream, all through this, we support both government and private sector in any knowledge products. We have a knowledge management action plan. We like to build capacity. We hold workshops, and we invite both private sector and public sector to benefit from that. From the other knowledge products which we actually publish, for all the DMCs that we work in, we publish a PPP monitor, and we also publish a subnational government financial monitor every year. So that also helps everyone to see what the landscape for PPPs are. And of course, these documents are sector agnostic, but they have, when DMCs are working on health as priority, then that does figure out highly in these products. The last slide on this one, and I won't spend too much of time here, just to show what has been the benefit of PPPs. And there have been discussions and debates about whether PPPs are the right modality for social sector or not. But just to give a snapshot of how it happens, you can focus only on the middle. And there had been studies done on how projects have done when PPPs versus public infrastructure in terms of cost overrun and in terms of time overrun also. And as you can see, the PPP samples have done better in all regards that way. It's not to say that there are no complications. Structuring PPPs are quite complex, and that has to be taken into consideration while getting into it. I'll stop for now. Would be happy to discuss anytime with anyone. Thank you very much. Over to you, SK.
Thank you, Dawal. That was a great elaboration about the role and the philosophies, principles, and the actual practice, really, of how ADB is engaging the private sector in healthcare. So very happy for this. If the audience will just permit me 1 second to confirm, we are able to welcome Minister Khairi Jamaluddin, the Minister of Health from Malaysia, to share his reflections on private sector COVID vaccinations in Southeast Asia. As part of a keynote, Minister Khairi is currently in Bangkok for ASEAN and APAC meetings for health. Minister Khairi, we're delighted to have you. The floor is yours for you to share your reflections on private sector COVID vaccinations in Southeast Asia as part of your keynote address. Over to you.
So, SK, can you hear me? Can I do a sound check first?
Yes, hear you well.
Okay, yeah, thank you. As mentioned by SK, I'm in Bangkok right now. We'll be having a meeting with my friend and counterpart, Kun Anutin, after this. We're discussing the exciting area of medicinal use of cannabis and trying to learn something from what our neighbors in Thailand are doing. Anyway, thank you for inviting me to this webinar. And I'll try to keep my remarks short for your benefit and also for me to carry on with my visit here. I think what I wanted to stress in terms of private sector engagement in the COVID-19 vaccination program in Southeast Asia is the simple fact that we gave more COVID vaccinations through the private sector than we did through the public sector or the public facilities in Malaysia. It was a national program. I oversaw a national program, which was the COVID-19 immunization program in Malaysia as Minister of Science and Technology then, but also as coordinating minister for the National Immunization Program. But very early on, we realized that the distribution and the vaccinations saves lives, not vaccines. You have to put the vaccines into people's arms. We figured out early on that we really needed to have a whole of society and whole of government approach. And that really required us setting up a strong and robust PPP framework, public-private partnership, by mobilizing not just government, but as I said earlier, by mobilizing private hospitals, private general practitioner clinics to administer the vaccines. And we're very happy that the success of our program, which has resulted in a extremely high vaccination coverage. 98% of the adult population have been vaccinated, and almost 70% of the adult population has received one booster dose. Many have received the second booster dose. And that has really been done because of the strong decision to have a strong and robust framework for public-private partnership, where vaccination centers were set up under the coordination and under the approval of the Ministry of Health, but run by our private sector partners. So that was the result of why we have 130% coverage of the entire population with the booster dose through the successful public-private partnership. I think what we realized very early on was that in order to emerge from the pandemic, we had to ensure a daily vaccination rate per capita that was extremely high. And having to work together with the entire government machinery, as well as the private sector and civil society, was very important, because we realized that nobody is safe until everyone is safe. So I think apart from the success story of private medical practitioners joining with us, running the vaccination centers that we set up in convention centers, community halls, stadiums, places of worship. I think the other very important success factor was also working together with civil society. By working together with civil society, I think, which is another important partner in the tripartite approach towards public health, we were able to ensure that the migrants, both documented and undocumented migrants, crucially, were also immunized and vaccinated through the program. We took a very we took an approach that prioritized public health, not so much on the immigration status of people. There are other government departments who are concerned about people's immigration status, but we were very clear as far as the Ministry of Health in Malaysia is concerned that of paramount importance is public health, and we must get them vaccinated. We translated the vaccination information in I think almost 15 different languages, reflecting all the migrant communities in Malaysia. We worked together with civil society who normally set up clinics for migrant communities so that they would administer the vaccinations and not the Ministry of Health Malaysia, just so that the trust was already built and the trust was already established with the migrant communities. We also worked together with the private sector in one other important regard. And we had a lot of requests from industry, especially from factories, from plantation companies, from construction companies, to get their workers vaccinated as quickly as possible so that they can keep their operations open in a safe environment. So what we did was we worked together with the Ministry of International Trade and Industry. We set up the what we call PICAS, which was the Program Imunisasi Industry Immunization Program. So we basically worked together with industry to set up vaccination centers in situ, in factories, sometimes grouping factories together and bringing licensed medical practitioners, usually from the private sector, again, the PPP approach, to deliver the vaccinations in plantations, oil palm plantations, at construction sites, as well as in areas, industrial parks where there were a lot of workers present. That was one of the key success factors in enabling us to keep our economic sectors open despite lockdowns for other sectors and for other people. That was also a key success factor for us in ensuring that safe at work practices were enhanced because of the extra protection that was afforded by workers who were fully vaccinated and fully immunized. And we did this as well for migrant workers coming into Malaysia. And all of this, especially those administered at our vaccination centers, covered either fully by the government, or for those in the industrial sites were covered by the employers, the big industry. So I think that in terms of the vaccination was the key lesson for public-private partnership. One other area which slightly out of vaccinations would be public-private partnership when it came to COVID management. So we realized at about August of last year, we were confronted by a situation during peak Delta that we simply didn't have enough hospital beds in our public hospitals and in our teaching hospitals within the public healthcare system. But we did notice that beds in private hospitals were still available. So of course, the right thing to do was to optimize resources, and we started decanting patients, and usually non-COVID patients, to the private hospitals in order to free up our resources in public hospitals to cater for COVID patients coming in. So that was a very, very quick and necessary pivot, and something that can be built on post-COVID in terms of strategic purchasing of services from the private sector, which is usually underutilized compared to the public healthcare system. The third area of collaboration was, of course, through COVID assessments. Our public clinics were overwhelmed by people coming in to see whether or not they had symptoms, whether they had to be referred to hospitals, whether they could go home, and we just simply couldn't manage. So we set up, again, a robust framework where they could go to private general practitioner clinics and they could be assessed there whether they were suitable for home surveillance or whether they had to be referred to either hospitals or the step-down COVID care centers. And out of this, of course, we created a whole new digital ecosystem. So after a while, the entire assessment process was done virtually, and it was done on our app. Everyone has a COVID app. Every country has a COVID app, and we developed ours. So end to end, the test, trace, and support was done online. And so we're pivoting that particular technology and app, and the fact that people are more comfortable about using an app for health purposes into developing electronic medical record that you can carry around with you. So we're pivoting our COVID app to become something of a lifetime health record that you can carry with you. So these are some of the key, I think, developments that took place in Malaysia, especially speaking to the title of the address that you've given me, which is Private Sector Engagement COVID-19 Vaccination Program, and for us to learn from how we were able to break down the silo between the public healthcare system and the private healthcare system, and also the private sector in terms of industry, in terms of technology, in delivering better outcomes during COVID. I tried to keep it brief, SK. I hope that's helpful. I mean, if there's anything you would like me to add, then please let me know. Thanks.
Thank you, Mr. Khairi. These are great elaborations about the role of the private sector in Malaysia in three ways. One, vaccination administration. Number two, healthcare delivery for COVID patients. And thirdly, COVID assessment centers. Obviously, I'm hyper summarizing your speech. If you have maybe a few more minutes, if I can ask you one question.
Of course. Yep.
Thank you. And the question would be taking us outside of Southeast Asia. What do you think are the best practices from other countries that perhaps you might want to institute in Malaysia, or you think other countries in Southeast Asia will be able to institute as well? Best practices from outside the Southeast Asia region.
Wow, that's look, nobody got everything right. I think everybody got something right. So we have to really sit down and see what people got right. Of course, I think one thing that we know now, and we have the benefit of hindsight, is how fast restrictions could have been loosened. And that was something that was somewhat of a gamble in some countries where outside of Southeast Asia, where they were done much quicker without the benefit of real world evidence. So I'm not sure whether that was done politically or based on science. But I think there's enough evidence and real world evidence to suggest that in terms of the non-pharmaceutical interventions that we can learn from one another. Maybe this part of the world, we were a bit more conservative when it came to lockdowns and other such non-pharmaceutical interventions. But again, the jury is still out, and I think we will have a better idea once the real world evidence is presented in more robust data sets on in terms of excess mortality, in terms of the morbidity of COVID itself and its long-term effect on people. Then we will have a better idea on who got what right and who got which bits of the response right.
Thank you, Minister. If you have one more minute, perhaps.
Sure, of course.
Great. We have in the audience with us today senior leaders in the Asian Development Bank, a lender, and we have senior leaders in the private sector as well, notably the president for Asia Pacific for Pfizer, whom you've interacted with, perhaps the company at least when procuring COVID vaccines for us. What messages would you like to share to the senior leaders in the Asian Development Bank and also the parts of the private sector?
Well, I think when you look at development finance, COVID has exposed tremendous gaps in healthcare systems around the world, especially in developing countries. It is a good time for a lot of countries to reflect on where their healthcare systems are and what longer term reforms they need to put in place. So for instance, in Malaysia, we've decided that this is the right time for us to present a new white paper in Parliament on the future of healthcare. COVID has laid bare the tremendous weaknesses and underinvestment in public healthcare. We've seen how our healthcare workforce was stretched and how the response could have been better if we were better funded and if there was better investment in public healthcare. So I think for ADB, there will be a lot of work to be done in this area in supporting countries in relooking at their healthcare systems, a systemic-wide review, and seeing how investments can be made into public healthcare, of course, in the right places. So for the Malaysian Health White Paper, there's a huge emphasis on shifting from sick care to healthcare and wellness. So just as we want our hospitals to be well staffed and to be better equipped, there has to be a lot more investment in enhanced primary healthcare, in prevention, in promotive health, because at the end of the day, prevention is better than cure. So we really need to move healthcare, or sick care rather, into healthcare which is closer to the community, closer to the individual, more personalized, and definitely not just looking at the curative aspects of treating you once you're sick. So a whole shift has to happen in terms of public health delivery in developing countries, including in Malaysia. I think a message to private pharmaceutical companies, and I see Anil's name here. He's been a strong partner to me personally, and also to Malaysia as the point person for Pfizer, and most of our vaccine portfolio came from Pfizer. But I think, and he knows my sentiments on this, notwithstanding our friendship and our close partnership, it's of course equity, and I think that is something that cannot be repeated often enough. When we talk about anticipating the next pandemic, which is really accessibility and equity to vaccines, not just in terms of price, but also in terms of delivery schedule. I think the greatest stress that I went through as the minister in charge was negotiating that delivery schedule with Anil and with other executives from pharmaceutical companies. So I think that was a weakness, even a failing, collective failing for all of us. And I think that's something that we really need to sit down and talk about dispassionately. I attended the World Economic Forum this year, and there was a special session on this to see how we can ensure that the hoarding and the inequitable distribution will not repeat itself when the next pandemic happens.
Mr. Kari, thank you so much. If you have any closing remarks, we'll be happy to hear them just before you prepare for your next meeting with the Deputy Prime Minister.
No, thank you. And thank you, SK, for hosting me. And once again, I'd like to end by just repeating something that I always tell people. And my journey to become the health minister is serendipitous. I'm not a doctor. I don't come from a public health background. I was just handling the vaccination, and the Prime Minister said, why don't you just go and become the health minister? But in that moment of serendipity, I have realized that this is the best time for health systems, public health systems around the world, for all the sacrifice that they have made during the pandemic, to demand for what they truly deserve, which is better investment, better support, better resources. Thank you.
Thank you, Minister Khairi. Well, we are having a good health minister in Malaysia. What we don't need is a medical minister.
Thank you.
Thank you, Minister. Have a good meeting, and we're very happy to have you. Thank you.
Thank you.
Ladies and gentlemen, if I can turn your attention away from Minister Khairi's speech and towards the panel that we've assembled today to speak about best practices from private sector COVID vaccinations in Southeast Asia, I'd like to introduce them briefly in turn. The first panelist that we have is Dr. Lei Shen, or as she prefers to be called, Shen. Shen is the CEO of the American Chamber of Commerce in Singapore, but previously she has a PhD in epidemiology from Johns Hopkins. She sits on the International Advisory Board for Johns Hopkins, and she's worked in and lived in, I think, 5 or 7 countries right now. I can't remember, Shen, there's so many of them. And we're very lucky to have you here as our first panelist, Shen. Our second panelist, if I may introduce him briefly as well, I'll just go through all of them very briefly, and then we'll turn to each one of them separately, is Mr. Anil Argila, one of Minister Khairy Jamaluddin's friends. Mr. Anil, or Anil, if I may, is the president of Emerging Markets Asia for the Pfizer Biopharmaceuticals Group. Anil started out outside the pharma industry, but I think he spent 16, maybe 20 years in Pfizer in total, operating in many Southeast Asian countries and also Asia Pacific countries currently based in Singapore. Welcome, Anil. Thirdly, Dr. Akrapon Kurusatra. Dr. Akrapon, or Akrapon if I may, is Assistant to the Director General of the Department of Health Services Support in the Ministry of Public Health in Thailand. Akrapon will bring with him the government lens so that we can look at private sector and how the private sector has supported COVID vaccinations, not only in Thailand, but perhaps even the principles of disengagement throughout Southeast Asia. And finally, Mr. Guillermo Luz, or Bill as he prefers. Bill is a Chief Resilience Officer of the Philippine Disaster Resilience Foundation. Bill, we're interacting for the first time, but I've known of Bill for some time because of the work that is done in civil society, in disaster preparedness, and also just generally in healthcare in the Philippines. Bill, we're very happy to have you. I would like to invite Shen to go first, or Dr. Lei Shen to go first for introductory remarks of 5 to 7 minutes. Shen, the floor is yours for you to share with us your introductory remarks about private sector engagement in COVID-19 vaccination programs in Southeast Asia, narrowly or more broadly on any topic that you would like to speak on for about 5 to 7 minutes before we move on to the next one. Thank you, Shen. The floor is yours.
Thank you, SK. Well, I'm kind of glad that Minister Khairy has, I think, left this meeting, because I'm going to repeat something that I said when I was on a panel with him a couple of months ago at the Saswi Hawk School of Public Health here in Singapore. And I think he poked a little fun at me at the time, but I sincerely believe what I'm about to share with you. So as SK shared with you, told you, my background is as a public health scientist and epidemiologist, but also at the same time, I've been in corporate pharmaceutical and medical technology for a number of years. And so I am trying to bridge this gap between science, business, and policy. And when I think about PPPs, which we have all, the fact that we're here, we agree that PPPs are absolutely critical. These public-private partnerships are going to fill gaps and also drive and accelerate progress in the delivery of healthcare. But we need to start thinking of public-private partnerships in a different way. Back in the day when I used to visit various country governments, and we would have conversations about how my company could support the healthcare system in that country, oftentimes the conversation would, of course, turn to funding and other types of support that were really monetary in nature. And so what I want to do is talk about today how PPPs can actually stand for something slightly different that then positions commercial interests, commercial organizations in a different light, as partners rather than as vendors. So the 3 Ps that I'm going to talk about in this vein would be on first P on products and services, the second P on platforms, and the third P on processes. Because in my mind, the goal of creating this public-private partnership is so that we are able to deliver healthcare even better than we would be able to on our own, whether as public sector or private sector. Now, the first P on products and services, it's pretty clear what those are and what the private sector can offer. There's so much innovation happening, including the COVID-19 vaccines, that it's clear that private sector has a responsibility to provide these products and make it equitable, as Minister Khairy said, make it possible for access to be equitable. So on the products front, clearly private sector would be able to provide this. But aside from that, we should look at private sector as a way to deliver products and services that are more efficient, more cost effective, so that these products, when they get to the end user, the patients or the physicians, are really used maximally, optimally, right? Now, aside from products such as pharmaceutical products, vaccines, and other medical technology, there are other services that I believe the private sector is uniquely positioned to deliver in a public-private partnership. For example, one of the issues that we've had in the COVID vaccination programs has been misinformation and communication. Now, for those of us like Anil who are in the corporate environment, we know that corporate communications, marketing are incredibly important. Companies invest a lot of resources into making sure that the messaging around their products and services is done just right, so that expertise is there. And how do we tap into that for these public-private partnerships? So once again, we're focused on the outcomes and the delivery of services, even more than what we could do on our own. Now, on the second P on platforms, here's where I also think the private sector has a lot to offer, particularly when it comes to companies in the tech sector. There's been a lot of talk around cloud. And we know that certain governments in the region have decided rather than leveraging cloud services from tech companies, they'd rather build their own. I'm here to make the case that actually having a strong partnership with the private sector when it comes to the cloud computing environment is incredibly important, because tech companies cut across sectors. The expertise is phenomenal. If we look at a Ministry of Health building its own cloud, I'm afraid to say that I'm not completely sure that they have access or are leveraging all the expertise that are really out there, particularly in the private sector. I could have other examples like that when it comes to analytics and data science, but I think cloud for me right now is the untapped resource in the private sector that both on the private sector side and on the public sector side, finding that connect in cloud computing could really accelerate healthcare delivery. The third P that I want to talk about is on processes. So we talk a lot about how to make healthcare services, how to make healthcare accessible, how to make it more efficient, and how to make it more fair. The other area would be around sustainability and risk. Private sector right now invests quite a lot on managing risk. Private sector really understands how to account for risk, how to make financial budgetary calculations to mitigate risk when they enter into a project. And I think that kind of specialization, that type of skill is also incredibly important when we think about public-private partnerships. And of course, when it comes to regulatory and other types of compliance issues, et cetera, in a public-private partnership, when the private sector agrees to enter into a contract with the public sector, when we need to take another look at how to make the environment more friendly to private sector when it comes to the latest innovations and the latest services that are being offered. I made this plea to Minister Khairy a couple of months ago, and I think he understood my point, but at the same time, the vision that the optics, the perception that the public sector has of the private sector of being a vendor rather than being a partner is going to be very hard to shake because of this focus on supposedly different outcomes, profit-driven versus patient outcomes, et cetera. But I think that's actually not true. I think everyone is focused on delivering better healthcare, better patient outcomes, and we just have to figure out how to leverage each other's strengths.
Thank you, Shen. Sorry, it took me a second to unmute myself. Shen, thank you so much for those thoughts and for sharing the 3 Ps, the products, platforms, and processes. I think it's important, you're right, that the private sector cannot just be a vendor. It must be almost an equal partner, so to speak. Of course, the word equal means different things to different people, and it depends on the political economy of different countries to define what does equal mean. Shen, thank you very much for your opening remarks. May I turn to Anil? Anil, your thoughts and your opening remarks on the participation of private sector in COVID-19 vaccination programs narrowly, but also more broadly to any topic that you prefer. Anil, over to you.
Hey, thanks, SK, and thank you all for the opportunity to speak on this panel. And to the earlier comments made by Sen and Minister Khairy, I think the pandemic kind of put a spotlight on the subject of private and public partnership like no other situation in the past in our lifetime, right? So I quite like the structure in which Sen has explained the 3 Ps and the fact that we all have a common context to deal with across the world during the pandemic, and the fact that we had a clear purpose made it very, very clear that this can't be a single stakeholder's role to help manage the pandemic. And it really was very, very apparent. And all the global community, the governments in Asia, pretty much everyone stepped up. And the way I see it is that we all felt that there was a role to play. And we knew that we had to work together, irrespective of what our roles were and which part of the ecosystem which we belonged to. In our part, I think Pfizer, we were very, very focused on where and how can we really make the greatest impact during this course of the pandemic and find innovative ways to expand access to our science. And our purpose is largely, even today, breakthroughs which change patients' lives. And I can't think of any better example of an opportunity of a product which probably had the maximum impact on patients' life, which is the vaccine which we developed and brought to the world. So from day one, we literally worked very, very closely with all the global governments and international leaders to ensure what Minister Khairy was referring to, a fair and equitable access to COVID-19 vaccines, and also the other therapies which we were developing. And through supply agreements and global agreements with the governments, partnerships with COVAX and others. Just to put the facts on the table, we delivered 3.4 billion doses of Pfizer-BioNTech vaccine, which reached more than 179 countries across the world, and several of them in Asia, and almost all of them in ASEAN, to really address the pandemic everywhere. And we continue to be committed to this. And it's not just the COVID vaccine, but we're also committed to ensuring equitable access to our Paxlovid, which is our antiviral therapy. And Pfizer has signed a voluntary license agreement with MPP, which is Medicines Patent Pool, to expand access to the oral therapy which we're developing and we brought into the world to more than 95 low and middle income countries. So to set the context that the pandemic literally made the partnerships happen naturally. So let me spend a little bit more time on the opportunities of this partnership. When we really think about in Pfizer's perspective, when we think about innovation, which was required to deal with the pandemic, we think about innovation as twofold. There's invention and then there's adoption. So we speak about innovation as invention plus adoption. And there's plenty of invention everywhere in the world. And we find that there's an opportunity for us to really reflect on the role which we all need to play in enabling and driving adoption of that innovation. Let it be in healthcare delivery mechanisms, let it be in access to medicine, let it be in putting our hands together and figuring out new digital models to solve for the problems which we have. And to what Minister Khairy was referring to, several of those inventions can be adopted to other things in the future, right? So one of the good examples of really partnership which helped us in adopting is a classic example of how we developed our vaccine with BioNTech. And BioNTech had its own strength and Pfizer had its own strength, and our corporate to corporate collaboration really resulted in bringing the vaccine to the world in a record time. And that's a great example of really moving at speed. And now it was not just vaccines and it was not just Pfizer. When I really reflect on it, I think the public-private partnerships which happened during the pandemic kind of helped us in creating a pipeline of therapeutics and vaccines, which were close to around 750 across the world. And just to put that into perspective, what we were able to do in the past 1.5 to 2 years during the pandemic and developing such a strong pipeline as an pharma industry or biotech industry wouldn't have been possible in the non-pandemic scenario to be done in maybe less than a decade. Okay, so the speed at which we got it done was absolutely commendable. But I think the key there was adoption. And what COVID and the pandemic really taught us was that there could be invention, there could be innovation, which could be happening in one part of the world. and then it can be manufactured or processed in another part of the world, and it can be completely adapted in another part of the world, as long as we are able to remove and eradicate the roadblocks which are there in adoption. And for us to be able to do that, I think the focus should be on creating systems, processes, and some of it, I think, Sen referred to, 3 Ps of establishing systems and processes of global reliance, as against a need to recreate locally. So I think that's a great opportunity for us to really think about partnerships in a different way. The other is, like I think Minister Kairi was referring to it, there's several players who put their hands together and made things happen. This was a great opportunity for several startups to contribute to dealing with the pandemic. I think it's also an important opportunity for us to really think about fostering and creating an environment where we nurture opportunities for startups to really partner and work together with several stakeholders in both in invention and adoption of the inventions. And from Pfizer point of view, we have really contributed to creating digital ecosystems. We call them digital hubs and centers. In short, they're really an opportunity for us to really work closely with digital startups by giving them an opportunity to partner with a large industry giant in incubating some of their ideas and finding solutions and figuring out if we can scale up those solutions to be able to be adapting to create much bigger impact. So in short, I think there are several opportunities for us to really work on, but if I have to also, SK, give you a broad sense of some global and local examples of where I've seen in real time some phenomenal partnerships which have come to friction during this pandemic. One of them clearly is, and it was a principle which Pfizer was believing in, which we knew that we had to deal with equitable access, and we worked very closely with governments, but we also worked with COVAX, and we became a big partner of COVAX. We're proud to say that 25% of what COVAX delivered to the world, which was about 467 million doses, came from Pfizer. And the other examples, I think similar to what Sen was referring to, we found that there were opportunities for us to do real-time assessment of systems and processes and capacities. So we partnered with COVAX to really assess supply chain capabilities, especially in lower income countries, to see what can be done and where can private partners intervene to support the lack of those capacities and ensure that supply chain capacities don't come in the way of our ability to bring medicines or vaccines to those countries. Another example was the UPS Foundation, which again partnered with Pfizer, but on its own as well. They did an amazing job of donating cold storage facilities for lower income countries, especially where it was not possible to find innovative solutions to bring in cold storage solutions so quickly into those countries. The third global example outside of ASEAN, which I can think of, was in Africa, where a company called Zipline partnered with us in delivering vaccines using drones, using technology, and we were able to deliver a fair amount of vaccines, especially in Ghana, where almost 40% of the population lived in rural settings where access was a challenge, physical access was a challenge, and drones were used to deploy and supply vaccines to them. So those were great partnerships, which were not companies which were related to healthcare, which partnered very well with the healthcare ecosystem to make things happen. But if I come closer to Asia, I think we're really proud to have partnered with the governments in Asia and ensuring that there was a quick regulatory processes to get approvals and get the supply chain capabilities built up to bring in our vaccines into this part of the world. And Singapore is a great example. Thailand, Malaysia, Indonesia, Philippines, and Vietnam are great examples in which we've been able to do that. Singapore has a 93% vaccination rate, and I'm happy that Pfizer was one of the core partners in making this happen in Singapore and several other ASEAN countries. And in Indonesia, we worked very closely with, we realized that the public education and collaboration with the patient organizations, medical and public health institutes was very critical, especially in increasing awareness and the importance of vaccination. And there were a lot of myths about vaccination. There was a lot of inaccurate information about vaccination. So we worked with the Ministry of Health, we worked with the Adverse Events National Committee, MAFINDO, which primarily fights fake news to addressing some of those misinformations and also creating much more knowledgeable public awareness on the importance of vaccination. We've done similar work in Thailand, but there I think we took on a role of building confidence and working with communities and frontline workers in healthcare space. Worked very closely with the Ministry of Health there as well, and the NHI and NVI, the National Vaccine Institute in Thailand, and driving those communication campaigns, which were very useful. I think in closing, when I really think about this, SK, the COVID and the pandemic have been fairly tiring on all of us, and they were difficult period for all of us to go through in the past 2.5 years. But I do believe that there are a lot of learnings to be accrued from this experience, and we can build a lot more resilient global healthcare ecosystem going forward. And I think to what Mr. Khairi was referring to, it's getting several governments to really reflect deeply on doing that for their countries and also collaborating with other countries to figure out the learnings. And I think Pfizer is deeply committed to breakthroughs through patients' lives, and we will partner with governments and other stakeholders in building this ecosystem.
Anil, thank you for sharing your thoughts and your experiences really leading Pfizer through the last couple of years, especially in vaccines, because Pfizer was producing and then distributing one of the most important items in human history, the COVID vaccine. Thank you, Anil. If we can turn our attention over to our colleague in Bangkok, Dr. Akrapon. Dr. Akrapon, over to you for you to share your thoughts with us about the best practices from private sector vaccination programs during COVID, perhaps in Thailand, and focusing a little bit more on Thailand, but also expanding your worldview to also include other countries in Southeast Asia. Over to you, Akrapon.
Good afternoon, everyone. Thank you for moderator. This is the experience from Thailand, how Thai government and the Ministry of Health do for the vaccination. I think the practice, any country have any practice, but this is the way of Thailand to do. I want to show about the context of the Department of Health Service Support first. The context of Department of Health Service Support is under a role and a mission under the law to approve and allow and supervise of the private hospital and clinic around Thailand. We have about 409 private hospital around Thailand, and nearly about 34,000 private clinic around Thailand. And at that time, we think that how we engagement of the private sector to deliver of the vaccine and the care system to the Thai citizen around the Thailand. So we draw the map just like this. How we action? We action about the operation of vaccination against the COVID-19 is made for all persons who living in Thailand, regardless of the nationality. The procurement of the vaccine is operated by the Thai government under the guideline of the Ministry of Public Health Thailand. The operators, we consist into two groups or the 2 points of key point. The key point number 1, it is the voluntary health volunteer. It is make about the important role. We consider to be about 1 million private individuals throughout Thailand, working to knock the door at the house at that time to provide about the accurate information of the COVID-19 vaccination and recommend to access to vaccine services at the hospital and clinic, including the public and private hospital. And the key point number 2 is the healthcare provider. It is the public hospital and the private hospital are responsible for providing COVID-19 vaccination service to people who live in the Kingdom of Thailand. Currently, the population in Thailand is about 66.15 million people. There are 5 types of corona vaccine available in Thailand: Sinovac, AstraZeneca, Sinopharm, Pfizer, and Moderna. Vaccination result since February 28, 2021. The first vaccination is 59.22 million doses. And the second vaccination is 53.66 million doses. And the third vaccination is 53.66 million doses. The important one thing also is the fiscal administration reimbursement for vaccine administration expense, comprising personal fees and the consumable is about 40 baht per time of injection. It's nearly about 1.18 US$ for vaccine administration. The payer is the National Health Security Office. An overview of the vaccination about across the country. Data collection is carried out by Minister of Public Health. This is the action of the Thailand is the how-to cooperation between public and private partnership to do together. It is the time of the focus on the vaccination. And after about when infection, the care system, especially in the Bangkok and the big city, mostly who responds and care of the people in the Bangkok or any metropolitan is the private sector more than the public sector. Thank you.
Thank you, Akrapon. Thank you for sharing with us the principles of how Thailand has implemented COVID vaccination programs from the private sector as well. And we look forward to the Q&A where we'll delve a bit deeper into Thailand. Thank you, Akrapon. From Bangkok, we will turn to Manila. In Manila, we have Bill. Bill, who is the Chief Resilience Officer for the Philippine Disaster Resilience Foundation. Bill, I'm told that you would like to share some of your slides. So please feel free to share your screen for you to, provide your opening remarks about public-private partnerships and private sector engagement for COVID vaccination programs, perhaps focusing on the Philippines. Over to you, Bill.
Yeah, thank you, SK. I'll dispense with the slides and just, give you a brief background of what we do and why we did it. And we had developed this public-private partnership between ourselves and various government mechanisms. And it didn't start just with the vaccines. It actually goes back all the way to the overall COVID response. So after the WHO declared the global state of emergency back in March 2020, we had set up by April 2020 a task force, became known as Task Force T3 for test, trace, and treat. And so our work covered that plus the vaccine deployment and the vaccination program. So we started first with working on developing the testing capacity in the Philippines for RT-PCR tests. And we expanded that from its original starting point, which was below 5,000 tests a day capacity, eventually helping the government build it up to 100,000 tests per day capacity. The private sector donated equipment, invested in labs, and also helped kind of just streamline the process to get labs built and certified by the government. From then, we also began to create and build and construct isolation and quarantine facilities, particularly in big cities, the capital region, so that as COVID spread, we could have a way of isolating the patients. We then concentrated as well on providing PPEs and even providing the medical fabric to manufacture PPEs within the Philippines. And in that regard, we work with UPS Foundation to bring the medical grade fabric in. We developed the, Dr. Kyrie was talking about this kind of the mismatch between the public hospitals and the private hospitals in terms of bed capacity. So working with Department of Health, we helped create what became known as the One Hospital Command to try to figure out where those spare capacities were and how to expand capacity, and then to refer patients from one hospital to the other, or patients so they could make an optimal choice of where to go. We also worked on data analytics. We brought in data science companies to prepare dashboards, data analytics, and that would help us in tracking down exactly how the virus was spreading, where it was spreading, and how to contain it. So all of this, we created different work streams that combined the public sector and the private sector. We started with 2 and eventually ended up with about 12 different work streams just to tackle each of these specific problems. And then a few months later, we began to focus on vaccine deployment and then the vaccination program. And here we work closely again with our interagency task force on vaccinations, on infectious diseases. We work with them on the vaccination program, and we started looking into certain aspects. We went into private sector procurement. So the private sector actually procured vaccines alongside the government in a tripartite arrangement with manufacturers. So private sector procured some AstraZeneca and Moderna, which it used not only for its own employees and dependents and partners, but also for vaccinating, helping vaccinate the general public. We also invested a lot in the public information and communications program, bringing together ad agencies, PR agencies, and research groups to design an advertising and marketing, social marketing program. We noticed that vaccine hesitancy was quite high. At one time, it peaked at around 30% hesitancy, but because of effective communications, we were able to drive that down below 8%. Private sector also came in and provided cold storage and logistics support and supply chain management, working directly with the Department of Health, with consultants actually hired for us by ADB so they could work directly with Department of Health on the supply chain management. We then developed a targeting system to go with that supply chain management so that cities could begin to target how many people they need to vaccinate every day in order to open up the economy by a certain deadline. And so by setting that target, we taught cities how to bring together and optimize vaccination sites, personnel, number of vaccines, number of people in the queue to keep going, to keep the line moving in vaccination centers, all the manpower. And by calculating that number, they were able to double, triple, quadruple their performance on a daily basis. And so as the vaccines started coming in, they would be able to consume the vaccines a little more efficiently. The private sector also provided vaccination sites. So while the local governments provided a lot of their own sites, the private sector came in and we used malls, we used schools, we used churches, we used fast food outlets like Jollibee and McDonald's as vaccination sites, and we used drugstores. So we went to the top 6 largest chains and we used drugstores as the site. And we teamed up with cities who were providing both the vaccines and the workers to be able to use those sites and improve on the throughput. And then, like all countries, we had a problem with, recruiting more and more workers because some of the workers were getting sick. So we also went into a healthcare worker procurement system together with Department of Health to try to keep on replenishing the workers and making sure that as people got a rest or were recovering from COVID, then we would be able to find more people. So it was a very large scale private sector effort. We all saw it with the government. We saw this as an existential risk. So we were all, similar mind on what we had to do to address this particular crisis. And what did we learn, I guess, from doing all of this? We found that this PPP brought together certain qualities. We were able to combine speed and scale. So private sector speed to respond was critical, but government scale of resources, when they came in, could really take advantage of the speed and then go and hit a larger segment of the population. The second was that we were able to structure the work so that it was very task driven, and that trumped actually hierarchy. So that trumped bureaucracy. We worked in small teams with very flat hierarchy, so we could move quickly. And every time we met, and we met daily, people were really kind of unaware of what positions were within the private sector or within the government. Everyone just so task driven and focused on the work. So that, I think, contributed to speed and overtook, problems with any hierarchy or bureaucracy. On the private sector side, one advantage we could bring in was a lot of technology and innovation and management expertise outside of the medical field. So I myself, I'm not a doctor. Most of the people we brought in were executives, CEOs of companies, people who are experts in supply chain management and marketing communications and general management. And we're able to harness all those resources to work with the government. And then the last point I wanted to stress was that for the Philippines, working with local governments was extremely important, meaning working with the cities. And we have 146 cities and 1,500 municipalities in the country. So not everything can be driven nationally, because where the rubber meets the road is really at the city level. So this required us to learn and to meet many mayors and figure out how things got done, because ultimately they were the ones who were able to really push the numbers as far as vaccinations were concerned. So that's how we structured our PPP for the Philippines. It was a very large-scale private public partnership. We have maybe 50, 60 companies at least at the core, and then a lot more at the fringe, helping out in different aspects. What we've done is we've created a video documentary, and we're in the process of finishing up a terminal report to try to capture all the lessons, because we're convinced that, of course, another pandemic will happen sometime, hopefully later rather than sooner. But certainly we need to remember all the lessons so that we can respond better. At the end of the day, we know a lot more now than we did when we started, and we've got to institutionalize that memory so that we can move forward and respond quickly and effectively in the future. So that's the story of our public-private partnership in the Philippines. Thank you, SK.
Bill, thank you, Bill, for that story from the Philippines. Ladies and gentlemen, we've heard from 4 different panelists, actually, from firstly Shen, and then to Anil, and then to Akrapon, and then now finally from Bill, hearing perspectives from systems, also the pharmaceutical industry, also Thailand, and also the Philippines. We're about to approach a time when the audience are invited to ask their questions. So if I may invite the audience to ask their questions in 3 ways. 1, you can verbalize your question if you would like. Number 2, you can send a message to the group or use a chat function. Or number 3, you can send a private message to me if you prefer not to be named. Please, my friends and colleagues in the audience, please go ahead and ask your questions. In the meantime, let me kickstart this bit more of an open Q&A. Perhaps starting with Anil, then going to Akrapon, then going to Bill, and then coming back to Shen. Southeast Asian countries need a very active, very sustainable and win-win partnership with the private sector. This win-win, sustainable and active partnership is intended for better population health outcomes. In your opinion, what's the ideal framework for such a partnership in Southeast Asia? What's missing, for example, that we can put in? So what's in your opinion, the ideal framework for ideal public-private partnerships in COVID vaccination programs, narrowly, but also public health largely? Maybe we can begin with Anil, then we'll go on to the other 3 panelists. Anil, over to you.
Yeah, so maybe I'll just try to keep this short and refer back to the last comment which Gil made is we do have a lot of learnings to take from what we've been through, right? And what really worked in my mind is, I think, being able to mobilize each other on a common purpose, okay, more than anything else, and to not let the complexity of our regulatory environments to come in the way. There were a lot of exceptions which we provided to ensure those pathways were created, etc. But of course, you can do that in a crisis setting. Can you do that in a non-crisis setting is the question to ask. Okay, and in my mind, I think there's an opportunity for us to really think about redundancies in the way we manage our regulatory environment and be able to rely on each other and create a lot more global reliance. And ASEAN as a set of nations have started to work on ASEAN regulatory harmonization, not just in healthcare, but beyond. There are opportunities for us to really tap on that and accelerate that, I guess. Yeah.
Thank you. Thanks for that, Anil. Akrapon, if I can turn to you, what do you think is the ideal framework for such a partnership in Thailand? What's missing, perhaps, that the partners that you have in Thailand, or maybe even the Ministry of Public Health, are building? Over to you, Akrapon.
I think the solution of the win-win solution is the key. Number one is the trust together between public and private. Trust together. Because when in Thailand to initiation this program, we have to reset the mindset together, that win-win partnership or trust together. The private sector can management any of public service in situation of the emergency situation. This is a mindset to do, number one. And the second key point, I think it is under the law and the regulation to creativity in the new paradigm, to give the opportunities to private to do. And the key point number three is the payment mechanism. It is very important, easy to talk, but when the operation is very important to do in the payment mechanism, for the payment mechanism in the on time also. In the experience of Thailand, we have the payment mechanism, it just delay time, maybe lag time between about 6 months. We have many about announcement to the government or public that why the payment mechanism is quite long. It's just to make to better and better in the future. I think the key point in quickly to the sustainable and win-win solution, in my opinion, is just like that. Okay, it's a moderator.
Thank you, Akrapon. I appreciate your comments, especially the bit about trust and how to build trusting relationships between the government and the private sector, civil society, providers and patients. And that's obviously a very ideal situation for us to get to. Thank you, Akrapon. Bill, over to you, Bill. What are your thoughts about what's an ideal framework for such a partnership in perhaps the Philippines, and then taking your attention to Southeast Asia? Over to you, Bill.
Yep, thank you, SK. You know, one of the advantages of working in a crisis situation is that when you enter into a partnership, you are really focused on the partnership side, not so much on the regulatory aspects of it. And there's no talk of, you know, vendors and things like this, because everyone's, you know, quite desperate to look for solutions at this stage, so that everyone's very open and committed to giving idea. So I think that part is good. Now, can that be maintained in a non-crisis situation? As Anil was saying, that's quite a challenge. But even in this crisis situation, there's not everything from our perspective in the private sector that we understand. So the decision-making process is not something that we fully understand in the private sector. And we're all new to the health field, you know, because we're non-health professionals. So we're not, it's not clear in our mind who's reviewing things and who's making recommendations and giving advice. And there are a lot of bodies and agencies and sub-agencies working. So I think to improve the framework, we're going to need to get a clearer understanding of what's in that box of decision making, how that works, so that we can help navigate it further. So that's one. I think the second is that it's got to be clearly for us much more data-driven and data science-driven and analytics-driven. It wasn't that way in the beginning. We had to, private sector had to invest a lot. But I think, as Shen was saying, I think, data is going to allow us to make better quality decisions and faster. And I think that in retrospect, if we look back at the experience of COVID in 2.5 years, we could have probably done a few things faster had we had a better grasp of data and the courage to use the data. It's one thing to have the data, but old habits die hard, and people want to be are a little cautious. They err on the side of caution, when in fact this is a case where you might want to move fast, because there are consequences to not moving fast as well. Consequences on deaths, by other causes other than COVID, or consequences on the economy, for instance, or consequences on poverty. So those types of things could be weighed much more effectively using data. So I would say that's something we ought to build into the framework.
Bill, these are excellent points, especially not only the collection of data, the accuracy of the data, it's also the use of the data, and often the use of the data requires political will, requires courage, that's both political as well as emotional in order to use the data, right? When the evidence is staring at us sometimes in the face. Thank you, I appreciate this. Shen, over to you, Shen. What are your thoughts about the ideal framework for such a partnership in Southeast Asia? What are the gaps maybe that we need to fill to reach that ideal framework? Over to you, Shen.
Well, I'm not sure I'm qualified to answer this question because, to be honest, I've never successfully signed any big PPP. So that's my confession. I sure have learned a lot in the process of trying to get one signed. And I think maybe this one is more of a mindset or an approach when you're thinking about what kind of PPP would make sense. In my day, I think I've made plenty of mistakes of going in and not listening properly and not asking the right questions to start off with, mainly being focused on what my company wanted out of the partnership, which often was to sell more product and not to ask exactly, well, okay, for this public-private partnership to work, aside from me giving you product, whether you pay for it or not, what other tangibles or intangibles could we actually exchange in this public-private partnership to make this win-win for everyone? And oftentimes we say, well, this product does X, Y, Z. And in the past, I used to sell the idea of value-based healthcare. All I really wanted was to be able to collect data. And I love that Bill talked about data, because all I really wanted was to be able to first get baseline data so I could create the right proposal that demonstrated to promise an improvement in outcomes and therefore get paid on it, because that's the concept of value-based healthcare, you get paid on outcomes. But I didn't quite understand what it would take to unlock baseline data from the partners who we were speaking to, and then to be able to use that to show them what improvement in outcome and efficacy needed to be demonstrated for them to say to their decision makers that this is a worthwhile public-private partnership to enter into. Because part of it is also, earlier was mentioned about speed and scale. Because while we could do speed, we couldn't do scale, because you want to ask me for 70 devices. Well, actually, to prove a benefit to the government, you really need 7,000. And I wasn't in a position to be able to give you 7,000, right? So there's a mismatch in understanding and expectation of what the other party really desires and what would be meaningful to enter into public-private partnership. I do have an example that I've admired ever since the start of the COVID pandemic, and that really is a Pfizer example. So I didn't plan it. Of course, I knew Anil would be on the panel, but it's something that I've admired for a long time, and I often raise it as an example, is the partnership between Israel and Pfizer when the vaccine was very, very new. And I admired it because I think Pfizer wanted out of it the ability to access data so they could show efficacy and safety. This post-market data that you need once the vaccine is rolled out. And what Israel wanted was a heck of a lot of vaccines so they could protect its population. And in the middle, what they were able to meet was this idea of we're going to have the data to understand safety and efficacy. We'll be able to do some analyses to see what level of herd immunity we can achieve if we can hit a certain percentage of the population with the vaccination. And I was just really impressed because all of that data came through. It was anonymized. It was given to the company to analyze. I hope I didn't get this wrong, Anil. And the data analysis and the publication of the results, it's incredible because I feel like it ticks so many boxes for both sides. And that to me is a really great model of a true public-private partnership where both parties got something valuable out of it.
Shen, thank you very much for this, for that example about the partnership between, well, sovereign government and also private company in the early days of the pandemic, and each achieving a win-win situation for themselves. Ladies and gentlemen, and my colleagues and friends, we're now at the time, according to the schedule at 4:30 p.m. Manila time, where we're opening the floor to questions from the audience. You can type your question in the chat room. You can send me a private message if you like, or thirdly, you can choose to verbalize by perhaps raising your hand and I'll call upon you. So while you get your questions in order, maybe I'll ask one more question to the panel. I was taken a lot by some of the things that you said. For example, concepts of trust, concepts of equal partnerships that are win-win, and concepts of using data. These are the three concepts that I would like to maybe build my question on. And the next question is, what are the principles, do you think, what are the principles that will be necessary for public-private partnerships in the decades to come? I'd like to take you into the future. Let's take 20 years into the future. What new principles will we have to build our public-private partnerships on, not only for equality, trust, data analytics? What new principles will be important to us in the 20 years to come? Because health security, public health, universal health coverage, health system strengthening, these concepts are timeless almost, and will need many, many years and decades for us to get there. So my question is, to take you 20 years into the future, what are new principles that we need to think about when building the framework for public-private partnerships, perhaps 20 years into the future? Akrapon, if I may, I'd like to start with you, just to let you have the first word over here, and then we'll move on to Bill, then to Shen, then to Anil. Over to you, Akrapon.
So, sorry, moderator, can you ask again, because I concerned with another conference. Please, the question again, please.
No problems. The question is, if you were to forecast the future and predict the future 20 years from now, what other principles will be important for public-private partnerships? We've discussed a few today. Right now, trust is important, like you've mentioned. Data is important, like Bill has mentioned, and equal partnerships are important, like Shen has mentioned. But 20 years into the future, what will be important then?
Oh, I think it's very hard to answer. Well, what is the next in the future of 20 years? I think if we have about the emerging diseases or any disease again, the principle may be about the principle to do again. We must to back up the data that we learn. Trust, it is very important. Data collection that we said, it is very important. And the final is the win-win solution that you said. I do agree all. The 20 years or 10 years ago, or 10 years after, for what more than this, about this principle, maybe all the principle. Thank you.
Thank you, Akrapon. Well, yeah, I think data will always be an important principle, and that's a good one for us to well consider. Bill, what about you? If you cast your crystal ball, shall we say, over the next 10, 20 years or so, over to you.
Yeah, thank you, SK. I think what we're going to need, well, we're going to need it well before 20 years, you know, maybe inside of 10 years. And I would say what's important is sort of a level of self-awareness and collective awareness. So at PDRF, you know, Philippine Disaster Resilience Foundation, where I do a lot of my work, we're dedicated to kind of addressing natural disasters, okay? And there were 4 types, and they included typhoons, earthquakes, volcanoes, and pandemics. But awareness level for 3 of them, at least in the Philippines, because we have a lot of typhoons and we're in an earthquake active area and we have a number of active volcanoes. The level of awareness and understanding and appreciation of data is getting better all the time. We used to not, pay attention to warnings as much, but because we do, levels of preparedness, prevention, mitigation are much better. It wasn't the case with health. It isn't the case with health, and it certainly wasn't the case with COVID. I mean, none of us imagined something of this scale. But now that it's happened, this has become sort of driven into our consciousness that, this could happen again. And I think, as Minister Kari was saying earlier, we need to get more into a wellness and preventive mode of thinking rather than curative, because, there's over the last 2.5 years, it's been a mad scramble to build in the protection through vaccinations. But that's something that now, as COVID has kind of waned a little bit, maybe it's time to make sure that we're preparing and our surveillance is much better so that we see things further out, and then we can try to prepare at least to face up to those eventualities and not get caught flat-footed again like we were in COVID. So I think this question of surveillance and awareness and preparedness, we've got to really build up, much in the same way that we've done it for typhoons and cyclones and weather events. That is a practice that we've all gone through. Now we got to do this for disease.
Bill, these are excellent points about the use of data and also prediction, predictive models, predictive tools, for example, to increase the sophistication of our use of data as well. I appreciate this, Bill. Shen, if I can turn to you, your crystal ball over the next 10 to 20 years or so, what new principles do we need for, shall we say, an ideal PPP framework? Over to you.
Thank you, SK. I think I might answer this question from my perspective as a leader of the American Chamber of Commerce, because we do quite a lot of policy work. We look at geopolitics, we do track all of that. And one of the biggest concerns I have that is relevant to public-private partnerships is the fragmentation of countries and societies, right? We're moving towards this world that's multipolar. It's very different than the world that we've been in before. Every single country has its own thing going on. And pandemic also highlighted this desire to take care of your own people, which is completely legitimate, of course, because that's the government's responsibility. But that's also led to what we talked about before, stockpiling when it came to vaccines. If I have a lot of vaccines from my country, what's my responsibility to my neighbors? And from a public health and policy perspective, we really have to think of it. It's an ethics question. And I'm worried that governments right now are moving into into a zone where we're thinking globalization is not a great thing. I'm not interested in having we could talk about bipartite and multi partner type of trade agreements. We're trying to figure out what is the new model for geopolitics moving into the future. We're in Southeast Asia, and I don't think I need to say exactly who we're being pulled against. I obviously represent American business interests. Moving forward, public-private partnerships, we need to think about what is the relative role actually of government in these partnerships, and how do we manage? I mean, when you're a big company, you're looking at, you're part of a big region, right? Whereas Acropone, you're looking at Thailand, but how do we actually align the interests of one country versus many? And for a large company, how do we then partner with more than one country? I'm kind of speaking in a convoluted way, but I find it very complex in my head. And I'm also very worried about what the next 10 or 20 years is going to look like when it comes to how countries collaborate with one another and how the private sector can play a role in encouraging governments to collaborate rather than pull apart and focus on their own needs.
Shen, this is a great thought that health systems are not just the science of it in a particular nation state within the borders of only one country, but rather very interconnected with other countries around the world and subject to forces of geopolitics, geoeconomics, and so on. It's an excellent point, Shen. Thank you. Something for all of us to consider as well. Anil, if I may end with you, your crystal ball, next 10 to 20 years or so, what's the another principle that we need to look at for public-private partnerships that are ideal? Over to you.
SK, I definitely am not clever, and so I will not be able to predict what will happen 20 years from now. And I wish I could. But I think I'll go back to the fundamentals of what other panel members were talking about. So, people are people. When I think about partnerships, partnerships happen between people. Okay, and to Dr. Akarpon's point, what do we do to ensure that the trust exists between the private and public partnerships, and it doesn't become transactional? In a crisis environment, when I really reflect on it, there's a sense of urgency which drives people to gravitate together and say, let's become not completely self-reliant, but reliant on others and bring their strengths to the fore. Now, how do you create that on a long term with a sense of purpose? Because you can't have sense of urgency, which primarily means if you have sense of urgency every 2 years or 3 years, we failed. Okay, as stakeholders we fail. I'm not necessarily saying as one party we fail. So how do we create a sense of purpose, and how do we get people to align on that sense of purpose will be critical. The other one is, like we talked about data reliance and building data reliance. I've seen both sides of the coin play out. I've seen through, and without taking examples, we all know, and we've all monitored this, and we've seen science taking the lead and driving decision making, and we've seen non-reliance on data, and we started using data to create our own misinterpretations of what it meant. So at some stage, I think we really have to think about processes, as Sen had talked about establishing processes which ensures that the science is leading our decision making, and that science might exist in one part of the world. And I've seen actually through this past 2 years, much more collaboration between the ministers of health across Asia. Okay, I've seen not just ASEAN, people talking to the New Zealand minister, people talking to the Australian minister, they're all talking to each other. And there was a lot more information which was being shared and being relied on. So in a way, informally, we were creating a kind of a global reliance of what existed across the world. Now, how do we ensure that we bring that to the fore and ensure we build on that? Okay, and I'm not a clairvoyant person, but I'm very confident that the future of contracts and agreements between countries will not just be bordered on trade. Okay, and they will be a lot larger than that. And I'm hoping that it will encompass all of this and create a model which is much more reliant globally. Yeah.
Anil, thank you very much. And thank you to all our panelists as well. I think we're approaching the end of our webinar today. I'm actually happy to close it slightly ahead of time, given we don't have many audience questions. So what I'd like to do is perhaps invite the panelists to share the closing remarks for a minute or so to your satisfaction, really. We'll begin with Bill, and then going on to Shen, and then Anil, and then ending with Akrapon, after which I'll deliver some closing remarks and we can close the webinar just slightly ahead of time. Bill, thank you so much for your participation in this webinar. Do you have any closing remarks, Bill? Over to you.
Yes, thank you, SK. Yeah, I think what we've seen in a public health crisis like COVID-19, that a public-private partnership is very effective in helping society cope with the crisis, helping find solutions, helping solve the problem, helping getting us out of the crisis and back into some semblance of normalcy. One of the questions that has come up in our minds in the Philippines is that, can we begin to replicate such a structure for other big societal challenges outside of health? And there are many challenges. The challenge of climate change, the challenge of malnutrition, the challenge of improving education. So there are a lot of things that can be done, and we're trying to see whether this model can be replicated, and if we can recreate the chemistry that happened, because this needed some chemistry to make it all happen, and the structure to solve other problems. And we feel it is possible to do it. And we think that we ought to take the lesson of all our public-private engagements and public-private partnerships during COVID and see whether we can put it to good use in some other societal or regional challenge. Thank you.
Bill, thank you. That's a great point about extrapolating from health and to other sectors as well, and how the effectiveness of this public-private partnerships. Thank you, Bill. Shen, if I can turn to you for your closing remarks.
Yeah, I like following Bill because I think what he's saying is go big or go home. And public-private partnerships certainly have that potential, but it does require us to, in some ways, suspend disbelief. It requires us to be more willing to take risks, and it requires us to trust one another. And all of that has been said and shared during this webinar, which I love. So from my perspective on public-private partnerships, as a public health scientist, we know that they're necessary, but we're not necessarily always good about figuring out the logistics of how to sign these agreements. But from the private sector, I believe that there's so much power in not just the resources that the private sector holds, but if we have a greater belief that contributions that we make to the community that we work in is important, then I actually would call on the private sector to do even more to push ahead on public-private partnership, to convince the governments that this is something that we need to do. I don't think necessarily that governments are always in the best position because there's so many factors that influence how government works, but the private sector can often be very laser focused. So I call on the private sector to do more in public-private partnerships.
Shen, that's a great call to action for more involvement from the private sector. I very much appreciate this, and I think many in the private sector appreciates this as well. If I can turn to Anil for your final remarks, Anil, as we close out the webinar. Over to you, Anil.
Thanks, SK, and I'll try to keep this short. And for me, I think that there's always been a great inequity in access to healthcare. And many of us as stakeholders, let it be in the public sector or private sector, we were always aware of this great inequity which exists. I think there's a great opportunity for us to realize that it cannot be solved by one part of this world. It cannot be solved by the state. It cannot be solved by private industries. It cannot be solved by the communities. We all have to come together to really build a reliant model to solve for it and have political commitment to solve for it. And I think there's a great opportunity for us to leverage the learnings from what we've been through in the past 2.5 years and take it forward.
Anil, thanks for that call to action as well. And certainly coupled with Shen's call for more private sector involvement, with your call as well, I think there could be hopefully more dynamic public sector, private sector, public sector engagements and partnerships in the years to come. Akrapon in Bangkok, if I may turn to you for your final and closing remarks.
Yes, thank you for the timely of the cooperation between about the public and private sector. It is very important role because in the emergency situation, I think we want about the timely to action in that time. Because at that time, about the public sector, we not have enough manpower to do. So only one arm that about the public and private partnership, it is can win and win solution together. So we think that if we have the facing of the emergency situation again, we will deal about it to do just as the COVID-19 what we do. Thank you.
Thank you, Akrapon. Ladies and gentlemen, my colleagues and friends and the panelists and speakers for this particular webinar for today, thank you so much for your participation. I thought we had a very good discussion. Allow me to have a very short summary. But before that, allow me to check actually that whether or not Dodo is here. Dodo, if you're here, may I invite you, if you're able to speak and verbalize, perhaps you'd like to have a few last words for yourself, Dodo. Over to you, Dodo.
Sorry. I want to show my video, SK.
Of course.
So, but basically, thank you to everyone. Great insights from the minister on how we should take advantage. We should not let what happened in COVID for the health sector, and in a sense go back to business as usual after COVID. I think his point that at the end of the day, the health sector really did great sacrifices for COVID. And just to reflect about it, many health workers died. lots of health workers really put in efforts. We're talking 24-hour, 48-hour work just to address the gaps. And then the private sector, of course, and we saw it both in the public and private sector. So we should reflect on that and make sure that those sacrifices should be built in by mobilizing more investment in that sectors. And as we listen to our four panelists, that we have seen how the private sector has really done great inputs, and we should now basically build on that. Thanks, Bill. Thanks, Shen. Thanks, Anil. Sorry, I'm in an airport, so I apologize if you keep on hearing that. But I think there's really a lot that we can start on working on within ADB. We'll mobilize as much resources as we have, as what the 1%, both from our PSOD, both from our Office of the Public-Private Partnership, from our sovereign operations, so we could help make sure that the gains that we have made in getting the private sector to work, the government will not be lost. Over to you, SK.
Dodo, thank you for that summary, and wish you a safe flight. If I may summarize the webinar that we've had today. Firstly, in terms of principles, win-win partnerships are based on trust, data, and equal partnerships. Number two, that there have been many good benefits that comes out of PPPs, that they're effective, efficient, it brings an all-of-health system response to COVID and specifically in vaccinations. And thirdly, the principle of shared responsibility, which is something that every panelist and every speaker has spoken about, that it's not just the responsibility of government to deliver health and public health and healthcare, but also the responsibility of the private sector. And certainly this is a great opportunity for us to find the opportunities and the timing that comes from COVID for us to do more to fulfill that shared responsibility. With that in mind, ladies and gentlemen, let me thank you one more time, and to the panelists, a note of congratulations and gratitude to our panelists and also our speakers. With your permission, we will close the webinar right now with best regards from the Asian Development Bank. Thank you, everyone, and wish you a great day. Bye-bye.